So what are the treatment options today for myeloma patients? Well, there's so many more options than just a few years ago. The general classes of drugs, the old guys, chemotherapy and steroids. More recently, we have the immunomodulatory drugs, thalidomide, followed by Revlimid or lenalidomide, and now pomalidomide or Pomalyst. We also have available two drugs with similar mechanisms of action. These are called proteasome inhibitors. We've had Velcade or bortezomib for about a decade, and within the last year, another drug called carfilzomib. We also have drugs that are not approved for myeloma, but that can be used, such as arsenic trioxide. In addition, there are lots of drugs now in development, antibodies, other targets that we can talk about as we move into the specific drug classes and options. Key point we've learned over the last few years is that actually progressing or not being responsive to one drug does not mean that drug will not work when combined with another agent that's been showing activity in myeloma. We've learned that with the proteasome inhibitors, first when Velcade was used, that if you failed it, say, with a drug like Cytoxan, you may respond great to a drug like Doxil or a steroid. The same is true with immunomodulatory agents. But what we learned more recently, even drugs in the same class, if you fail with one, you may respond to another. So a Velcade failure, say with a Cytoxan alkylating agent, may respond to bendamustine. And even more startling is, failing to one immunomodulatory agent, such as Revlimid in one combination, may show responses when the same combination is used with Pomalyst, a drug in the same class, another immunomodulatory agent. And we have shown most recently that patients failing the proteasome inhibitor Velcade can often respond to the same combination when the Velcade is replaced with carfilzomib. Thus, the number of choices for myeloma patients today is so much higher because we didn't used to think like that as oncologists. But now we know that patients can have many responses to drugs when they're used with other agents, even if the patient didn't respond to that same agent when given in a specific combination.